Welcome to Policy Chats, the official podcast of the UC Riverside School of Public Policy. I'm your host, Dori Pham. Join me and my fellow public policy classmates as we explore potential policy solutions for today's most pressing societal challenges. Today on Policy Chats, I'm excited to welcome Erin Edwards, the Executive Director of Blue Zone's Project Riverside. Erin, you bring nearly 2 decades of experience in public service and nonprofit leadership, and you have previously served as Riverside City Council member, where you have led initiatives on homelessness, affordable housing, community engagement, and public health. Before elected office, you have worked on organizations including the United Way and served 2 terms with AmeriCorps. Today, you join us in advancing a healthier, more connected communities across Riverside through your leadership with Blue Zone's Project Riverside. Thank you so much for coming on.
Thanks for having me.
Yeah. To kind of start off, my first question is, Blue Zone focus on shaping environments that advocate for healthy choices and make them easier access. From your experience in the local government, what are the hardest structural barriers city face when trying to redesign everyday spaces for health rather than convenience or speed?
That's a great question. I'll say that it was such an honor to work in local municipal government and to have an opportunity to represent about 45,000 people in Riverside's Ward 1. And I think the most important thing to know about a local government is that it is comprised of people, of human beings who are experts in their field, who are just trying to do everything they can to put their expertise to use for the best of the city that oftentimes staff members live in. That said, staff members can't live in every neighborhood. They have one experience, right? And then they use their professional expertise to think how to take their experience of the city of Riverside and extrapolate to other areas in the city. And so your question was, what is the biggest barrier? And I would say one of the bigger barriers is community engagement in local government, because we need the community from across the city to be able to engage with city staff and elected officials to let them know what are the issues that they're facing? Where are the areas that they might need a sidewalk? Where are the food deserts, and what solutions do they have to help solve these problems so that policymakers and city staff and residents can be working together? And I do think that that's something that the city of Riverside is doing well in having a community engagement toolkit and really thinking through how to seek that feedback, hear that feedback, and incorporate it in policy. And it's something that they're always striving to do even better.
So I want to start by saying thank you for joining us, and I really appreciate the work that you're doing. And in a general sense, I really want to give credit to the Blue Zones Project for helping people think about systems, right? Systems that create public health, systems that create longevity, systems that help us thrive. Because oftentimes I think we don't necessarily see how our built environment, how things that we are provided lead us to better health outcomes and better success in life. But I had some concerns about Blue Zone's projects that I was hoping to have you allay my concerns. And I hope you saw these questions in advance. So I had sort of 2 things that have made me concerned. One that's less important, one that's more important. The less important one was I'd seen some data suggesting, or some analysis suggesting, that the identifications of the places that were identified as blue zones might have rested on data that were faulty. That, in other words, not necessarily identifying high rates of having centenarians in those populations. Now, there's been some follow-ups that have contrasted with that. So I'm going to say that's a concern, but it's a less important concern. my bigger concern is that if we start with zones that have produced high rates of centenarians, and we identify the systems and policies and community attributes in those places, it's not necessarily the case that any community that established those policies, community attributes, would necessarily see the same result. Partly because we're going from the outcome to try to deduce what the policy might be, but we're not necessarily following places that have implemented those policies to see if it generates those outcomes. So how do we think about whether what's happened in those particular communities, whether those are really characteristics that we ought to emulate in other communities? How do you think about like the evidentiary basis for what Blue Zones is recommending?
Thank you for sharing those questions and concerns. And so I'll take a first stab at it, and then you tell me if you have any remaining questions there. So the first is to the research of the 5 original Blue Zones. And I'll say for the audience, the Blue Zones Project Riverside, is based on research in 1999 that Dan Buettner, then a National Geographic Fellow and now the founder of Blue Zones, had identified as being areas where people were living remarkably long and remarkably healthy lives. And actually, the reason that the company is called Blue Zones today is because Dan Buettner was making blue dots with a blue pen on a map to say, oh, something interesting is happening here. And so Dan Buettner and a team at National Geographic went and actually compared the demographic data to the stories of the people on the ground. And you had said that you've heard that maybe some of that research has come into question. And so I'm happy to say that we've had further research to really underscore the validity of that research. And also, I think there were some concerns with a non-peer-reviewed paper, pre-published paper that was making some of those questions. And so we're happy to say that we really do believe in the integrity of that data. That said, I love your second question so much because what you're asking is, how do we know that the qualities of those 5 original Blue Zones will work in a city like Riverside? So when Dan Buettner went and explored these 5 areas to try to see what's happening here, he found 9 qualities that all 5 of these areas share, even if they have different languages, different landscapes, different cultures. And today we call those the Power 9. And I don't think that any one of these elements of the Power 9 would be surprising. It's not rocket science. It's how you move your body, moving your body naturally, what you put in your body, thinking of a largely plant slant diet, though it doesn't have to be entirely plant slant. And in fact, if you look at some of the original Blue Zones, they don't have a fully vegetarian diet. It's just that meat is treated like a treasured guest, if you will, not someone who comes every day all the time. And thinking about how much food we're putting in our bodies, eating until we're about 80% full. Also in the Power 9, we're thinking about ways that we as individuals know our own sense of purpose, our ikigai, what gets us jumping out of bed in the morning, why were we put here on this planet? And finally, elements of connection. Do you know your neighbor? Do you feel like you belong in your community? And areas where people are living the longest, healthiest lives are areas where people are practicing all 9 of these elements in various ways. I absolutely believe that those 9 elements are transferable to any community. And in fact, if we know what those 9 elements are, there's no reason that we can't, with a little bit of hard work, make any area a Blue Zone. And I'll just conclude because I know we're going to dig even deeper into it. We start with these 9 qualities, the Power 9, but we don't stop there. So for our Blue Zones project, we actually, before we even launched day 1, we had a 9-month foundation period where we met with local leaders, where we formed a stakeholder steering committee, where we met with people out where they are in community to say, what are the biggest issues that you face in your Riverside built environment, and our Riverside food systems. And then we built a strategy document that, yes, follows a national model of what Blue Zones communities look like, but the issues that we're working on are very, very relevant and connected to what Riversiders want to see and what Riversiders want to advance. And that's how we make sure that the work is meaningful to our community and ultimately advancing health and well-being for Riversiders.
Yeah. If I could follow up. Thank you for that answer. Yeah, one of the things that is a struggle, and I think it's a struggle for public health work and public health research, and it's a struggle for public policy research in a general sense, is the way I would see what's happened here is we've identified these places that appear to be places that generate longevity. And let's accept that it's correct, that we've correctly identified those places. We've identified these commonalities. I would think of that as a really good potential hypothesis. Like, in other words, we could say these appear to be kinds of characteristics that if we implemented them broadly, they would be successful. Where I would hope that we could go, but that's challenging to go, is we take those hypotheses and then we start implementing them. And we implement them ideally randomly. And then we see, does the communities that implement them randomly get longevity, and the communities that don't. Now, let's talk about the practicalities of that. So one of the examples I gave ahead of time was, suppose that you'd found those 4 or 5 places all had a compulsory schooling law that you must be in school to age 14. Just hypothetically, this is not the case in these actual places, but suppose that was what you found. Well, then you'd want to know, if we tested that, if we could hypothetically randomly assign some communities a compulsory schooling to 14 and others to other thresholds of compulsory schooling, and then trace them forward and saw what happened, we would then know in a kind of more scientific way that these are the policies that lead to the longevity. But we have a lot of challenges in doing that. One is, it's very challenging to actually do randomized policies across communities. Second, to really do that effectively, you need to wait 50 years, 80 years to really see what happened to those school children that had either longer or shorter periods of time in their compulsory schooling. And so we have to act in the now, and we don't have the opportunity to wait. And so I find that with a lot of these kind of community interventions, we're acting on things that, to me, appear to be more hypothesis than evidence-based. But that's the challenge is it's hard to have the good evidence. So how do you think about this challenge of operating in a world in which we don't have complete information on what the evidence would say about what leads to a healthy community?
Well, I love what you said about acting in the now. I think that's really important. Also really important to note that while Blue Zones Project Riverside is based on research done with the 5 original Blue Zones, we ourselves are not a research project. We're a community-based health and well-being initiative, and we have the benefit of being one of now over 80 cities in the United States who've gone through a community transformation process like this. So we do have evidence-based best practices about what does tend to work when we look at our 4 policy areas, which are built environment, food systems, alcohol, and tobacco work. And we are working with policy experts across the nation who have the benefit of looking on a national scale of what does work when we think of tobacco policy, for example. And I'll give actually a really granular example for our city. One of the areas that we're working in is really trying to help youth stop smoking, or even better, not start smoking in the first place. Because when you talk to doctors, even on our local steering committee, they'll say one of the best indicators of a long life is not to start smoking in the first place. And so we say, all right, well then what local policies can we put in place here? So we work with national policy experts to help us see what's been done in other places. And we'd identified that if we could help decrease the number of smoke shops within proximity to youth-oriented places, places in the city of Riverside, such as schools and parks, that really could make a big difference, because then when my third grader is walking to school, if she can walk to school, if she has sidewalks to walk on, which is another question, a built environment question, right? When she's walking to school, she's not walking by smoke shops. She's not smelling flavored tobacco thinking, that seems like candy. Maybe I want to try it, right? And so we've had a lot of great conversations with local elected officials in our city who also have concerns about smoke shops and safety around these particular retail areas. And we were able to help support a moratorium on new smoke shops coming into the city. Now, a moratorium is a good first step in some cases because it helps you take a pause to examine data and to talk to business owners, to talk to residents, to policymakers, and then to take the next step, which is come up with a really good policy for the local place where we are. And that's something that our project is also able to do, to be at the table, to come up with what is the right policy for this place. So I do think that we're building on best practices and then tailoring them very locally. And we're also recognizing that Riversiders are deserving of health and well-being, and we don't have the luxury of waiting until we know what the exact best right thing is to do. We know what are some good next steps, so let's start there. And then at every juncture, we have an opportunity to take the next best step in consultation with community and moving forward with a love of place.
Thank you. And before I turn it back over to Dori and Shivani, I want to ask, or just make an observation. So Mount Rubidoux. So Mount Rubidoux is kind of, I think, a really good example of a place-based policy that could lead to better health. It used to be a road that cars would drive up. And as I understand it, Professor Leveridge, when he was Mayor Leveridge, was one of the people advocating for it to be a pedestrian-only or walking-only, and I guess bicycles as well, kind of space. And so now we're at a place where, as I understand it, 2,000 people on an average day are walking up Mount Rubidoux. So this is kind of a clear kind of public decision that leads to the ability for people to be more healthy. I was curious, are there things that you are talking with city leaders now? Are there ways in which people are receptive or oppositional to creating place-based policies that create community health?
Well, I'll start by saying I am grateful to former mayor and Professor Leveridge every single day for so many of the things that he did in the city. I love that you called out Mount Rubidoux. The pedestrian mall is another where people can get out in the heart of the downtown, explore local businesses, walk with their family, go to the farmers market. I love that example of great policy. And to your question about what is the Blue Zones Project in Riverside doing today to continue policies like that, I'll share that, yes, we're so lucky that now our downtown, thanks to leaders who took extraordinary efforts, is really quite walkable. But if you live in other areas of the city, that's not the case. You have a very different day-to-day interaction with the city of Riverside, where you need to get in a car to access fresh food, where you can't easily walk in to local businesses, where it doesn't feel like a neighborhood. So part of our project, as we consulted with local elected officials and with businesses and residents, was to look at the Arlington Village area of Riverside in Ward 5 and to say, how can we make this area more walkable? And you're absolutely right that anytime you make a policy change of any kind, there will be people that will be for it and who will be against it because change is hard. And that's certainly something that I saw during my time on city council. It's so important to introduce change incrementally when you can, so that you can bring stakeholders together, you can listen to feedback, you can address those pieces. And then sometimes at the end of the day, you just need to make a decision as a policymaker that's in the best interest of the most people. So going back to this example of Arlington Village, we're working with a council member to do crosswalk art, and we were able to hire a local artist who made a beautiful design, because what that art does is it gets people to slow down and it beautifies this area of the neighborhood. And then what we're doing next is we'll do a Ciclavia event in February of 2027. You heard it first here, where we're actually throwing a neighborhood block party that's about 1.5 miles long. So we'll close down the streets. We'll invite cyclists and kids on roller skates and people to come out and walk, to really be able on their own 2 feet to explore this commercial corridor in a new way. It also brings in people from outside of town to see what's happening in the city. And so this is a really great way to help festival-like street policies and to really spark a new understanding of how to interact with a city in the day-to-day. It's something that I'm quite excited about. But we're doing it, back to the point, slowly. We're not throwing a big event tomorrow. We're really intentional about the artist that we brought in to do the crosswalk art. And that artist was really intentional to talk with business owners, to talk with the elected officials' office, to see what kind of images are exciting to the community. What do they want to see when they're walking across the street? And then that was incorporated into the artwork. Well, now you have buy-in and excitement and a business district saying, wow, yes, let's do a bike event together. How can we partner with you? And that's how you start to bring people in, so they don't feel that change is happening to them. They feel that the change is happening with them, because it is.
Social injustice, health disparities, and climate change. Are you interested in pressing challenges like these facing our region and world? Make your impact by joining the next cohort of the UCR Master of Public Policy program. Learn more at mpp.ucr.edu.
Could you talk about what's the process by which a city gets Blue Zone designated, and are there any? Do people have any concerns about it being too commercialized? In other words, that is it a pay for play, that you have to pay to become certified, but the cities are willing to do it because they can attract businesses, noting that they're Blue Zone designated. So if you could talk just about what's that process for becoming designated?
I'd be happy to talk about the process. So I mentioned that we spent the first 9 months of our project just building the strategy to make sure that we had the right elements within our document. And so you can go to our website, bluezonesprojectriverside.com, and you can actually see our strategy right there on the homepage. We called it a blueprint. Of course we did, because it's Blue Zones. And in that document, you'll see that our work is divided into 3 pillars. And I'll do a quick glimpse into those pillars because it answers your question about certification. We're a 5-year project. So the first thing we need to do in our people pillar is we need to meaningfully reach 15% of the population. Why 15%? Well, because 15% is shown to be the tipping point to where a behavior isn't just something that some people do, but something that's really woven into the fabric of a city. So we're working with individuals to help them understand their purpose, to help them think about healthier ingredients they can incorporate in recipes that they already love and make, to think about how to walk just a little bit more, as examples. But then, of course, it's not just about what we as individuals do, but the systems and the places that surround us. So let's look to places, our second pillar. If I've made some changes to my own personal eating habits, so I'm eating more plants, but I can't find any fresh food in my local grocery store, or there aren't any vegetarian options for me when I go to a restaurant in Riverside, it's going to be very hard to continue making that healthy choice. That's why in our places pillar over the next 5 years, we've identified that we need to reach 14 grocery stores to help them become Blue Zone Project approved, 44 restaurants over 5 years who will go through a process to become Blue Zone Project approved, which is meeting with our team, going through a menu of best practices, making some of these small but really crucial changes to support the well-being of a community. We're also looking at work sites in the city of Riverside, because I can go on the best morning walk and I can eat the best food that I prepare for myself at dinner. But if I am miserable for 8 hours in the middle of a day, I can never have the well-being I crave. And then we're also needing to be in 50% of Riverside schools and have them be Blue Zone Project approved in order to reach our certification. And then finally, there's our policy pillar, which I think we all would nerd out about around this table. We're all policy nerds here. We've identified 30 policies in our built environment, alcohol, tobacco, and food systems areas that we need to either implement or further over the next 5 years in order for us to be a Blue Zone Project certified city. So when we do all of that, there will be a process at the end of 5 years by which we'll be able to certify and celebrate that we've done the work. And I'll also share that in addition to those metrics pillar by pillar, our project is also being guided by the Wellbeing Index that Gallup put out. So we have identified 20 measures in the Gallup poll that we're tracking. We have our baseline data. We're about to see data from year one, and we need to see an improvement, either going up or down, depending on the metric, in at least 8 of those 20 measures in order for our project to be certified at the end of 5 years. And I'll say to your question about pay to play, first, I want to share gratitude for the funders who've made this possible. We have the IEHP Foundation, IEHP, Kaiser, Molina, RUHS Public Health, the County of Riverside, and the City of Riverside, who have all invested in this project in the City of Riverside so that we can be fully funded to dig in and do this work over the next 5 years. And the biggest value add, I think, of a Blue Zones project isn't that we're creating all of these things from scratch. That would be a terrible model for sustainability. It's that we can be conveners, that we can be amplifiers, that we can be storytellers, that we can be, in some cases, project managers as we've identified these policies, that we break it down. We have a team of 10 people who will really get the work done and are supported to do so. And I am thrilled when I think about not only the City of Riverside being able to do this work, but also Coachella, Palm Springs, Banning, Meade Valley in our county, who've started as the first cohort of Blue Zones Project cities. So we'll have in our case, a 5-year project, and the other cities, a 3-year project, to dig into their blueprints, to do the work alongside the people who've been doing it, who will continue to do it. And then I think we will just see opportunity and possibility grow and grow and grow across the county.
Great. Thank you so much.
So yeah, as a follow-up, you mentioned that you are working with local businesses, local communities to help them improve and better their, let's say, standards of living, or like Blue Zone verified of way of living. Is there any way that Blue Zones is motivating these businesses, these local communities to partner with Blue Zones? Because I know that you mentioned the local government is supporting Blue Zones in helping these communities, but have you seen any kind of like reaction from these local communities, this local business, to the new Blue Zones project?
Well, first, your question was how we're inspiring local businesses. I'll actually start answering that question by talking about how local businesses are inspiring us. And I want to share a story of last night. Actually, we had the ribbon cutting, the big blue ribbon cutting for the very first Blue Zone approved work site in the City of Riverside. This is Phoenix Technology. It's a company that makes fire helmets. And I had an opportunity as a council member to take a tour of Phoenix Technology, and I would highly recommend anyone who can ask for a tour. They lead them regularly. It is the most extraordinary local company that really gets what it means to invest in people. In fact, they make fire helmets. Their tagline is better people, better product, better planet. So they're thinking about how their work building fire helmets that are going out across the nation, across the globe, are not only keeping our firefighters safe, but also that the people who are building them have the highest quality of life and are invested in as workers, as employees, as community members, and as a family at Phoenix. And so having long been inspired by Phoenix technology, they were one of the first local companies that we approached to say, would you consider going through a process to become Blue Zone Project approved? And we just had so much fun working with the Phoenix technology, learning from them, being able to share some best practices from our policy menu for work sites that maybe they were things that they hadn't thought of or that they had been thinking of but didn't have the time and space to do yet. And we were able to come alongside and support. And being able to cut that blue ribbon together was just such a lovely celebration of absolutely the work that Blue Zones is doing and will continue to do for 5 years, but also this spirit of innovation and investment in a local workforce that Riverside has had for a very, very long time. And I want to share something else about last night's ribbon cutting that was so inspirational to me. It was the first work site that had been Blue Zone Project approved, and I looked out in the audience and I saw one of our first local restaurants that had been Blue Zone Project approved right down the street that came to support them because they were neighbors. And to me, that's the goosebump factor that this project is bringing together neighboring businesses, just neighbors in general, to say, wow, I've worked down the street from you for years, but I didn't know that you were here. And now that I know that, I'm going to cater from you next time. And so here's the plug to the Cookie Tin out on Spruce, which is also a neighbor to UCR in many ways. They have delicious fresh salads and wraps and soups that we love in our office. And so any opportunity that we have to tell the story of local businesses who, again, are in many cases already doing these really great things, but maybe haven't had the opportunity to talk about their work on a podcast like this one, that's a value add that we can bring as a project to inspire Riversiders to go to these restaurants, to explore job opportunities at these great local businesses, to applaud the work that teachers and administrators are doing right here in our local schools, to buy products from this grocery store, or when you have a night out, to look at the list of Blue Zone approved restaurants and say, we know that these restaurants have really done the work to be healthy and to think about our community first, and now we want to think about them.
Awesome. So I have another question. You talked about the kind of 9 elements that influence the longevity of life in Blue Zones. And I was wondering, with those 9 elements, how Blue Zones Riverside decides which community changes to target first or prioritize.
Oh, so the 9 changes, the Power 9 that I had talked about a little bit earlier, I would say that we don't pick one and say, let's prioritize this one. We're trying to look at them all as a package. That said, Riverside's a big city, and there are many different neighborhoods here. And some neighborhoods, as I referenced earlier, already are pretty walkable, where others might need more support there. Or some neighborhoods have neighbors who get together regularly in some of the many neighborhood groups, and others don't have a group like that, so neighbors feel disconnected. So part of our work early on was meeting with community leaders and residents, stakeholders, to try to understand what are the assets in different areas of the city and what are current nonprofits or government leaders working on in these areas. What are their priorities and how can we amplify those? So when we find, oh, this is a neighborhood that would really like to increase walkability, that's great. Let us come in and support that there. Maybe they don't need as much support right away in thinking about healthy food, but a different neighborhood that's a food desert maybe needs more support in that area. So we try as much as we can to be just responsive to what different communities need.
Yeah, and a lot of public health work takes years and years to show results, and it can be like a slow process. What early signs do you look for that tell a community-wide approach like Blue Zones is actually starting to shift behavior or culture even before the data fully catches up?
I really appreciate you underlining that policy change takes a long time. In a lot of cases, this is generational work. The seeds that we're planting, we might not see in our lifetimes. Doing policy work is really hopeful work. And to your point, we might not know in data in the long term how some of this work will turn out. But because we're looking at the Wellbeing Index and the Gallup poll and other community chosen indicators in our blueprint, we'll have an idea year on year of if the data is going in the right direction. And when we look at that data year on year, we're also aware that a Blue Zones project isn't the only reason that the trends are going in one way or another. We're just one small piece of many community organizations who are coming together to do this work for the long term. So we have an opportunity as we look at the data year on year to ask ourselves the question, this data doesn't seem to be trending in the direction that we wish. What could we do better? Who can we partner with? Where can we build capacity as a city or as a region on this particular data point so that we can see this at least going in the right direction, maybe next year, ideally, or 2 years from now, or even a decade from now. But if we don't put in the work now, we'll never start to see that change.
And then another question that I have is, so the School of Public Policy's motto is solutions for the region, solutions for the world. And the Blue Zones project kind of has a similar message, but a bit of a like opposite of that, flip-flop of it, where it's using solutions for the world and using those to develop solutions for the region.
Oh, that's such an interesting point. That I love that.
So with that in mind, I was wondering how the Riverside project specifically kind of fits into work happening nationally and globally. What do you think that data or research or changes happening here, how that can impact and help shape changes around the U.S. and the world?
That is such a gorgeous question. Our vision is that we're helping everyone, everywhere, live better longer. And for our local office, our team of 10, for us, most of the time, that means everyone, everywhere in the city of Riverside. That said, as Riverside residents, we don't necessarily see the geographic boundaries that way, right? And so we have friends and family who live across the region, and we think of ourselves regionally. So I'm thrilled that our project is just one of 5, the Coachella, Palm Springs, Banning, Mead Valley, and Riverside, working across the county to try to make the healthy choice the easy choice so that everyone everywhere in Riverside County can live better longer. And I do want to add, this particular model was chosen for this first cohort of cities because our Riverside County Public Health Department has an audacious goal. And I love an audacious goal. And the goal is that Riverside County will be the healthiest county in the nation. How amazing is that? So to be part of this first group of Blue Zones project cities that gets to put the wheels in motion is really quite an honor. And on top of the work happening in our county, I'd mentioned we're one of 80 cities across the nation who've done or are doing Blue Zones projects. So I have the benefit every day of also working with teams in Scottsdale, Arizona, in Petaluma, California, in Jacksonville, Florida, who are already doing this work, who are in different stages of this work, and who have a lot to share with us about what's working, what's not working. And in addition to that, a whole structure of national team members who've done this work in Hawaii and can share learnings from early days of the project there. So it really is ripple effects, I think, of seeing something at the hyper-local level and then to see examples, real-life examples from what that's looked like across the nation, building on really exciting best practices coming from around the globe.
Yeah, thank you so much for your answer. It's really amazing to hear how the Riverside County is actually taking the first steps to becoming a fully Blue Zone verified county in the nation. So I guess my question is, before you come, like Blue Zones come into any environment and into any communities, are there any steps in your project that you are taking to advocate and I guess PR or promote the Blue Zones project to the local communities, or are you just going and knocking on doors on every doorstep, or how's that process? What does it look like?
Before our project launched, and our project officially launched in May of 2025 to the community, but before that, so much work had to happen. You really hit the nail on the head. I had mentioned that we had a 9-month period of planning just to get ready to be able to launch a project. And before that 9-month period even started, you look back a couple of years and you see leaders in RUHS Public Health who were seeking out that model, who wanted to learn more about Blue Zones. And then once they did learn more about Blue Zones, who really put in the work to make sure that this model would be a good fit for this county and different cities in this county. So when I was still elected to the city of Riverside and our city council, I remember the earliest days of this project where the public health department gave a presentation to us about, here's what this model is and what resonates with you or not. And then we were able to give feedback as elected officials to take the time to learn about it, to ask any questions. And then after that meeting, there were more steps to really dig into the community to see what ingredients exist in, I'll just say the city of Riverside, because that's the project that I have the honor to lead. What ingredients already exist in the city of Riverside that we can build up to make sure that after the completion of this 5-year project, that we're really setting this city up for sustainability in these changes and behaviors. And after doing that really intense deep dive into those ingredients, there was a stakeholder meeting where we were able to bring in not just elected officials, but also leaders of nonprofits and health-oriented organizations in the city to be able to hear more about what the model is. Again, to ask their questions, to share, wow, this really sounds a lot like what I'm doing over here. If only we had X, Y, or Z, we could do this so much bigger. And then all of that was included in some of the foundational documents that we used to build our own local blueprint that's guiding this work over 5 years. So it was years of work under the surface, like the duck feet, right? Before the project actually launched to the public.
I have one more question for you, and it's kind of about progress and looking forward. So after 5 years, when Riverside hopefully reaches the point where we're a Blue Zone certified county, how do we ensure that progress doesn't stop after those 5 years? How do we make sure that we continue growing, continue promoting longevity within the region?
That really is the question. And I say the first thing we do is that we note that we don't wait for 5 years to start talking about sustainability. So every time that my places team is going into a work site or a school, a restaurant, or a grocery store, as part of the Blue Zone project approval process, they're putting a sustainability plan in place. How are you as a business or as a school going to continue these behaviors? What additional resources might you need to help you sustain it in the long term? When we're looking at partners for some of our community engagement activities, we have really understood that a best practice is not to host all of our activities at our own office that are Blue Zones events led by Blue Zones, but to go to community groups where they are and co-design programming with them that meets the needs of their community. Because again, it's another way of saying, I don't know what Blue Zones will look like 5 years from now, but I do know that this great organization will continue to be doing the work that they have always done and that they are uniquely positioned to be able to do. So how can our programming help bring them new audience members, new stories, new resources that will build their capacity to do the work? And then when we think about policy, good policy is also about sustainability, and it's what makes it possible for the healthy choice to be the easy choice. I often say, how dare we ask people to walk more if they don't even have sidewalks in their neighborhood to walk on? And so the work of our policy team is thinking 5, 10, 50 years in the future to make sure that once our community engagement team has done the work of sharing why it's important to take more steps, that people have a way to make those steps right where they live. So I'm proud of the way we're already starting to have these conversations about sustainability, and that's absolutely the way that any project like this needs to be thinking and functioning to have the success that we crave.
Wow, thank you so much for your impactful insight on the Blue Zones project. I think it's a great way to end here our podcast. So thank you so much for coming on, and thank you so much for having this conversation with us, diving deep into the Blue Zones project and what you guys are really about. And so thank you so much for coming on Policy Chats.
Thank you for having me.
Thank you for listening to Policy Chats, the official podcast of the UC Riverside School of Public Policy. If you enjoyed today's episode, be sure to follow us on Instagram at UCR_SPP. To learn more about our program and upcoming episodes, visit spp.ucr.edu. For the video version of this episode, check out our YouTube channel at UCR School of Public Policy. Until next time, stay informed and stay engaged.